Welcome to the Herbal Hour. I'm your host, Stephen Horne, and we have a special guest with us today, Dr. Kimberly Ballas, a naturopathic doctor and a wonderful clinician. And we're going to be talking about a very important topic. We're going to be talking about inflammation. Inflammation is the match that lights all disease, or in other words, the beginning process of all illness. And so this is a real important topic to understand, because if you understand inflammation, you'll understand a lot about how disease gets started in the body, and also how we can prevent a lot of chronic disorders and other serious problems. Well, the first thing that comes up is, what is inflammation? Well, inflammation is the body's initial response to any kind of irritation, tissue damage, or infection. In other words, anytime we have a damage to the tissue, this inflammatory process sets in, and it actually is a very, very important process, because it actually is part of the healing and self-protective mechanism of the body. Now, the symptoms of inflammation are four. They are heat, swelling, redness, and pain. And these have been defined for a couple of thousand years, since the days of Hippocrates. So what causes these different symptoms? Well, first of all, the heat is caused by increased cellular activity at the site of injury, and also oxidation that's taking place at the site of damage due to the activity of white blood cells and lymphatic components. The second component, the swelling, is caused by the dilation of capillary pores, which allows fluid and protein into the tissue spaces in increased quantities. And this is it allows those white blood cells to get into that area so that they can clean up any debris or damage that's taking place. The redness is caused by the fact that there's an increased blood flow to the area. The blood vessels are dilated above the affected area, and they're constricted below the affected area, which causes a pooling of blood at any inflammatory site, and that causes the redness that we see in conjunction with the inflammation. The pain is caused by two different things. One is tissue swelling that puts pressure on the nerves, and the other is lack of oxygen to the tissue. And there's also some chemical messengers called eicosanoids that hypersensitize the pain nerves so that you get an increased sensation of pain. And this is, of course, acute pain. Now, I mentioned that these symptoms have been known for a couple thousand years, and in Latin, inflammation is itis. So all itis is inflammation for Latin. So a lot of diseases were originally named as the sites of inflammation in Latin. So arthritis, inflammation in the joints; bronchitis, inflammation in the bronchioles; appendicitis, inflammation in the appendix, and so forth. Laryngitis, sinusitis, tonsillitis, bursitis, dermatitis, etc. It's just basically naming the site of the organ or system which is red, swollen, and hot and painful. So that kind of takes the mystery out of it, doesn't it? I mean, you go to the doctor and you have heat and swelling in some part of your body, and you say, look, I'm hurting here, and it's swollen and it's painful, and he tells you in Latin, yes, you're hurting there and it's swollen and painful. Okay, big deal. Of course, not all diseases that involve inflammation have itis in their name. There's a lot of other diseases that involve inflammation. Heart disease, we now understand, begins with inflammation. Aging is a process of chronic inflammation. Cancer begins as an inflammatory process. Allergies involve inflammation. Autoimmune disorders are inflammation-based. And of course, there are many, many others. As we mentioned, since this is the initial response of all tissue to irritation, damage, or infection, basically inflammation is probably involved in just about any disease you can manage. Now, Kim, you do a lot of blood chemistry analysis, so you've got some blood chemistry markers that tell when inflammation is present in the body and whether it's acute or chronic. So you want to share a little bit about how you tell about inflammation from the blood?
You can look at certain tests and tell, and again, distinguishing between acute and chronic, because the body should have an acute response to some things. It needs to create inflammation for certain healing processes. When it goes beyond an acute and it stays in that chronic phase is where we're starting to get degeneration or the onset of disease stuff going on that are going to be more severe. There are a couple of blood tests that you can look at. Two specifically are your albumin and your globulin, and how those form a ratio. So when we have like an acute inflammation, then we know that it's going to be do like those normal ranges on albumin, the AG ratio is 1.1 to 2.5 is kind of a normal range. And we know that when you get more of the acute inflammation, the body's healing response, that it actually is between the 1.6 and 2.0. And you can see that that falls within that range of the 1.1 to 2.5. When you get more of the chronic inflammation, however, it tends to go lower or equal to 1.5. And even though that 1.5 is still within range, it's starting to creep out from perfect to the extremities of the range.
In other words, this is a way of telling whether the inflammation going on in the body is acute or chronic.
It's going to tell you which way it's going. And the reason that we look, well, it's an albumin globulin ratio. And the reason we look at albumin is because it's used to, albumin in the body is used to repair and rebuild tissue. So we know that when it's in those normal ranges, that in that 1.6 to 2.0, it's repairing and rebuilding exactly what it's supposed to. But when it starts going out of that range, away from perfect, we know that it can't keep up with the repair and the rebuilding. So it's kind of like, you know, you're going out to build a house with one nail. You don't get a whole lot done. So it can't keep up with the inflammatory processes in the body, and that's where it becomes chronic.
Okay. And what's the other test that we've got here?
Well, with the globulin, globulin basically is produced in the thyroid and the spleen where the albumin is produced in the liver, but it helps with antibody formation, helps protect the gastrointestinal cells. It's also responsible for digestion and absorption. So when you're not absorbing your nutrients and you can't absorb what you need to heal, then you push the body to stay in an inflammatory response. So that's kind of why we're looking at those two tests. Some additional inflammation markers that you can look at are the monocytes, and this is going to be in your CBC portion of your blood work. The monocytes plus the eosinophils plus the basophils, when you look at those totals together and it's between 5 and 7%, that's okay. You're in a healthy inflammatory response and the body's trying to fix or repair some type of damage that's went on. And we don't really know always where that damage has gone on in the body, especially if it's on a cellular level, but we know the body's trying to fix it. But when we get into more where it keeps going into the chronic inflammation, then you have these same three factors, the monocytes, the eosinophils, and basophils, add up to 8% or higher.
In other words, when there's more of these, it's showing that there's a chronic inflammation present in the body. Okay.
So just some factors to look at because, you know, you're looking at how with albumin your osmotic pressure becomes disturbed. You're looking at your eosinophils and your basophils are like almost like your allergy type markers. You know that they're indicating inflammatory response in the body.
Okay. Well, let's talk. Obviously, there are two kinds of inflammation here. There's the acute inflammation, which is the healthy response to any kind of tissue damage or whatever. And then there's the chronic inflammation, which is the inflammation that isn't healing properly and is just remaining kind of stuck around. So first, we're going to talk about how to deal with the acute inflammation, the healthy kind. And the healthy inflammation represents the body's attempt to fight infection, repair itself from damage, fight cancer, and process toxins, including heavy metals. So this is a normal body response that happens with any kind of cellular damage. Now, to understand what's going on here, we need to understand a little bit about what happens at the cellular level. Normally, with healthy cells, the cells are held very close together, and there is a very minimal amount of fluid in between the cells. You can see in this picture, the cells are very tightly packed. The little red circles in this screen represent the albumin, which is what Kim mentioned, the smallest of the plasma proteins. And the albumin is the primary protein for maintaining what's called osmotic pressure. That means water molecules tend to attach to albumin and protein, and that holds them in the circulatory system so that they can't leak out through the porous membranes of the capillaries. And so that's what keeps most of the fluid in the circulatory system. So under normal conditions, the little blood capillary, the fluid's coming down into that capillary under pressure, and little bits of that water are knocked loose and pass through the membrane into the spaces around the cells, bringing the oxygen and nutrients to the cells. and that's represented by the little blue dots or the water molecules in this picture. Little bits of albumin are forced through the tissue spaces and have to be picked up by the lymphatic system, which is the backdoor system that drains away excess fluid and protein from the tissue spaces. Now that's how normal, healthy cellular circulation works. And what happens when tissues get damaged is you go through some phases of inflammation. And do you want to kind of just go through these with me, Kim?
Sure.
So the initial phase of inflammation is going to involve the tissue damage.
Right. Mostly from the bacterial and the microbial toxins. Then also the heat or the radiation.
Others getting burned or
right.
whatever.
You know. Trauma.
Cut, smash.
Cuts, even hangnails, you know.
Right.
A lot of people get a lot of inflammation tendencies. Just you pull a little hangnail off. Paper cuts. Paper cuts are probably the worst.
Yeah,
That's
absolutely.
Trauma.
That is trauma, definitely.
Allergens, when we have an allergic response or reaction to something.
Which you know, we all have foods that are allergen producing. You know, like a lot of people, it's wheat, it's corn,
Nuts,
dairy,
yeah.
nuts, etc. And we'll eat those foods, and they produce an inflammatory response.
Right. Or it could be a skin response as well. Some people will break out in hives with certain foods and things. So.
Right.
Proteolytic enzymes released from invading or damaging cells. So the tissue breakdown begins at that point.
Yeah, well, if the cell has a damage, it releases these compounds, and then that causes more damage. And the same thing happens with bacteria, which release enzymes to break down protein in between the tissue spaces and spread
Right,
the
release the
infection.
histamine.
Right. So in the initial phase, what happens is the tissue damage causes a release of histamine, which is the first chemical messenger involved in inflammation. And that's followed by a release of bradykinin, serotonin, and other chemical mediators. And the primary thing that happens is these cause those capillary pores to dilate. In other words, they open up, get bigger, and that initiates the inflammatory process.
Right. And then when you have the albumin that's supposed to be holding that in solution drops too, then it's easier for it to pass through.
Starts leaking into the tissue spaces.
Right.
Okay. In the second phase of inflammation, we have these little tiny chemical messengers, which we're going to talk a lot more about later in the video, called eicosanoids. The ones that most people have heard of the most are the prostaglandins, you know, COX-1, COX-2, because of the drugs that have been developed for that. But these eicosanoids are little chemical messengers, kind of like primitive hormones. They're released by every cell in our body. So in response to this release of histamine, bradykinin, and so forth, these little eicosanoids that are pro-inflammatory are released into the area, and that makes the blood vessel pores dilate even more, which is what allows the white blood cells to pass out of the circulatory system and get into the area that's been damaged, so that the immune system now can go in and kill the bacteria, fight off the toxins, etc. Of course, the eicosanoids, particularly a certain type called leukotrienes, increase the permeability of the blood vessels to create more swelling. The next phase of inflammation is more histamine, and leukotrienes cause bronchial constriction and also increase mucus production. And that is so that since the mucous membranes are like a primary line of defense, it causes a flushing of fluid on the mucous membranes to try to flush away whatever is irritating the tissues. Eicosanoids also sensitize the nerve receptors and so forth. Now there's a third phase of inflammation where another kind of eicosanoids called cytokines signal the white blood cells, which are mostly at this point macrophages and neutrophils. In other words, it sends out the message and attracts those white blood cells to the area so that they will come and clean up the debris. And the white blood cells use free radicals. This is something people don't understand. Our immune system generates free radicals to destroy bacteria, damage cells, and so forth, like kind of burn them up. And that free radical activity, the superoxide and hydrogen peroxide that's generated by our own white blood cells, can damage surrounding tissue by causing oxidative stress. So it isn't just environmental oxidation that can cause free radical damage, it's actually our own body. What we need antioxidants for as nutrients is having a high level of antioxidants protects the healthy cells from the immune damage. In other words, it's sort of like protects against collateral damage in the war. But if antioxidant levels are too high, what it does is that suppresses the ability of the immune system to actually fight the infection. So that's the downside of antioxidants is if you get too many of them, it's not going to be helpful. Now, that's the first part of the inflammatory process. What happens is, and I got this from Barry Sears, who wrote this really great book called The Anti-Inflammation Zone. He says most people stop there and they don't consider that there's a second half to this thing, and that's the healing phase. In other words, once this whole process has happened and the white blood cells are in there, now the body comes along with a hormone from the adrenals called cortisol. And it's like, okay, we've got a war zone. We've got fires everywhere, bombs have gone off, bullets, everything's flying. Cortisol comes in and it just hoses the whole thing down, stops prostaglandin, eicosanoid production and everything to dampen the inflammatory response. And that allows the macrophages that are already there to clean up the remaining debris and initiate the healing process, which then leads to the tissues starting to be able to regenerate, and a new kind of eicosanoids are released to stimulate tissue growth and repair. And these, in the healing phase, the regeneration begins under the influence of eicosanoids called lipoxins and resolvins. So these little chemical messengers play a role in all of these different stages of this process that's taking place. This next little slide shows what 6 cells, look like. In other words, here we have the pores are dilated, the albumin, the water, et cetera, is flooding into the tissue spaces. That's when you're getting the swelling, the pain, and so forth that takes place here. Want to tell them a little about the lymphatic system, or have any comments on what we just...
Right. Well, I was going to make a comment on the cortisol, because now it's like the big cardio risk factor that we're looking at, not only with C-reactive protein, but with cortisol levels, and doing AM cortisol testing. And with all the people that have the elevated cortisol levels, we're looking at what is the body trying to tell us with that response. So, with the stress that's going on and cortisol being elevated, we look at how that's going on here with this eicosanoid production. And it's like trying to put the fires out, but they just keep springing up. So it's kind of like having these rampant brush fires going on in the body that the body can't control.
Well, one of the problems that Dr. Sears talks about with this is that since cortisol dampens all eicosanoid production, it also is dampening the ones that promote tissue regrowth and repair and regeneration.
Tissue regeneration.
So when you have high levels of cortisol, it's inhibiting healing from taking place. And basically you're just stuck in that process.
And you can see how you can just keep replicating unhealthy cell structure, and that puts us into cancer phases as well. Yeah,
and scarring and other problems that take place when tissue doesn't heal properly. Also, you can see why that would cause problems with the corticosteroid drugs like prednisone and so forth, because they're doing the same thing. You're taking those drugs constantly. You're not only inhibiting the prostaglandins that are involved in inflammation and pain, but you're also inhibiting the prostaglandins that are involved in tissue repair and healing. So that's going to cause long-term damage in this whole process. The lymphatic system is really important. Now, it's funny because I don't see this mentioned much in the books, but the lymphatic system is what is pulling this excess fluid away from the tissue spaces to reduce the swelling and so forth. And as the lymphatic system permeates the entire body, a lot of people don't understand this. And in the picture here, we'll put that back up again. The lymphatic system drains through a series of lymph nodes into some major ducts, the biggest of which is the thoracic duct, pictured going up the center of the body there. And that carries the lymph back into the subclavian veins at the base of the neck. And if you can, in the acute stage of inflammation, if you can stimulate lymphatic drainage and promote better lymphatic drainage, you can actually get into the healing phase a lot faster and kind of reverse the injury very rapidly. Years ago, from Dr. C. Samuel West, who had gotten into this cutting-edge research on the lymphatic system, we learned that when you smash your finger and you grab hold of it, if you keep applying the pressure, it keeps the fluid from accumulating in the tissue spaces, and that keeps the cells so that there's a good flow of oxygen and nutrients coming into the area. And if you just hold it until the pain goes away, you'll be able to let go of it, and there'll be no more redness, no more swelling, no more pain, and you won't get a bruise, and the thing will continue. And so you can move the lymphatics through deep breathing, and through other techniques. So primary pain relief techniques that are useful for acute inflammation, especially with injuries, are pressure, applying massage, or doing a very rapid light stroking to increase lymphatic drainage. Dr. Jack Shields demonstrated that rapid light stroking, just going like this, dramatically increased lymphatic drainage, and I've used that in a lot of cases to wipe away bumps and bruises and so forth.
But if you watch kids, they instinctively do that. They get burned, they go, ow, 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 ow. So kids already know.
It is instinctive. It's instinctive to rub, massage, whatever, wherever we feel pain. And that's because it increases lymphatic drainage, and lymphatic drainage is extremely important to getting rid of inflammation. And I don't see that being taught very much in the books, but it's very clear to me that that's an essential part of this, especially what I learned with Dr. West. Now, of course, I also mentioned that there are some other techniques that can help with the acute inflammation. Deep breathing, stretching, both of those move lymphatics. Also electrical stimulation. These little piezoelectric devices are things that put a little bit of electrical current or magnetism even, magnets.
EMST.
Yeah, will help with moving the fluid and keeping the inflammation away. And of course, you can do that with your hands. Energy healing work. A lot of people do Reiki and other kinds of energy healing work. Healing touch. And that will help with that. Kim, do you want to talk about some of the remedies that you can use for acute inflammation?
Right. This is to help speed up the process of tissue repair, because the body is doing what it's supposed to be doing, so you want to help aid in that. One of my favorite ones to use is Nature's Fresh. It used to say pet deodorizer on it. Thank goodness they've removed that now. It's a lot easier to explain it to people now that it says enzyme spray. And it is. It's just 6 categories of the microenzymes, which contains 1 category that has the macroenzymes in it too. So that helps to actually go in, because what do you need to rebuild healthy tissue? Enzymes. Okay. And especially like any type of auto accident, those types of acute injuries coming up with the spine, whiplash, things like that, it's really good taken internally as well. And I know it doesn't say that on the bottle, but I use it probably as much internally as I do externally. So
well, it is non-toxic, so
it's very non-toxic, and I use like 2 teaspoons a day. Unfortunately, with Nature's Fresh, you do have to do it straight or just in water so that the enzymes aren't interacting with other stuff, and it doesn't taste real good.
Yeah, it's kind of soapy.
Yeah, it's a little
like
soapy.
Like having your mouth washed out with soap when you were a kid.
But
of course, maybe your mom
really
never did that to you.
No, never had that. But it does work.
Okay.
It works. So Nature's Fresh, the Healing AC cream, which has the calendula in it,
and the arnica.
And the arnica is excellent for topical bruises, inflammatory responses. Not to use on open cuts, but to use just on injuries.
It's amazing to me how fast arnica takes down inflammation and swelling.
Rapidly.
And promotes. So, what's interesting is when you look at this, the fact that these are doing, even though there is not like scientific studies been done on this, these have to be affecting these little eicosanoids that are taking us through the healing process here. That's what that's what I would assume. And
then you have yarrow, which is actually a blood purifier. So what are we looking at with a blood purifier is going on, like we talked about with the whole lymphatic system and helping remove the debris when we saw the little healthy cells in there, and removing the debris out of there and moving the lymphatic system along and helping with stagnant conditions to keep the blood from pooling.
Yeah.
So yarrow I've used topically and internally for injuries.
Yeah. Yarrow is one that is good for when it's actually bleeding too.
Right.
Oh, I might mention one other thing about yarrow, which is that when you get the bruise, what's happened is that because there's so much dilation of capillaries, you get red blood cells going into the tissue spaces, and that's what turns everything black and blue. That's called stagnant blood in traditional medicine, and yarrow is very good at moving stagnant blood. So it's very good at helping to prevent and heal that kind of bruising.
And then bone and skin poultice, which we all have used, like topically, is what it was originally formulated for, but internally as well. It will help with pain relief, acute inflammation, inflammatory response, especially I find like in joint areas and like spinal areas, it works really effectively. And then of course, Thai fu oil. And if you've ever smelled that, everybody always knows when the bottle's open in the classroom, somebody has the Thai fu oil out. And that is, it has a menthol base in it, and that helps. Actually, it does have a heating and then a cooling effect with it, so that's going to help bring a healing response to the tissue as well.
Mm-hmm. There's also some stuff you can take more internally. A lot of that was more topical, but what are some of those?
Right, and then some general remedies internally would be the IFC, which is to reduce heat, and then VSC, which most of us know pretty much for viral conditions, but it does work for inflammation. Tygo, which has the xanthones in it, that's working for a lot of the antioxidant properties with the anti-inflammatories in it, and then your whole leaf aloe vera,
which is very cooling and soothing.
Very cooling and soothing.
And promotes tissue repair. One other thing that we should also understand is that part of what happens, especially with inflammation on the mucous membranes, is it's trying to flush an irritant. So the next slide is a graphic we've used a lot to demonstrate that in acute disease, the line you see there represents normal vitality. The tissue becomes hyperactive because it's trying to get activity going there to get rid of whatever was irritating the body and flush it out. And the disease crisis is the point at which the body is able to mount an effective response that coughs, sneezes, vomits, diarrhea, whatever, flushes that irritation somehow out of the system and promotes the healing. And if you try to suppress that healing response, you actually suppress the body from being able to recover from the inflammation because it's never able to discharge the irritation. So let's switch to dealing with the chronic inflammation. And what happens when you don't actually get the irritation flushed or the inflammation actually doesn't heal properly is the body goes into deeper stages of disease and stagnation. This is demonstrated by this next little chart, which I know you mentioned Dr. Bernard Jensen taught this with regards to iridology.
He taught this in regards to iridology with the different colors of the lacuna in the eye, the different degenerative processes, and it applies across the board, I think, to a lot of stages of disease going on in the body. When you go into, the acute that we talked about in the first slide, then going to this one with the subacute, of being just a little bit further down on that degenerative process, and then going into chronic, which is what we're going to be talking about here with chronic inflammation, into a totally degenerative state where the body's going like into an atrophy type condition.
In other words, chronic inflammation leads to tissue degeneration is basically what we're saying here. So there's sort of 4 stages of disease here. Your acute irritation, which is your acute inflammation. Then your subacute inflammation is a congestion or stagnation where the fluid flow slows down, the lymphatics don't drain very well anymore. You get a kind of an accumulation of fluid that's chronic in the tissue spaces, and that leads to a chronic or low-grade inflammation with depression of tissue function, which eventually leads to tissue breakdown. This next information is some of Barry Sears' signs of chronic inflammation plus some that we threw in. And so here are some things that might say that you have this chronic low-grade inflammation going on in your body. One is excess weight, cravings for carbohydrates and sugar, feeling hungry all the time, being fatigued, especially after exercise, brittle fingernails, limp hair, being constipated, kind of feeling sleepy and feeling groggy in the mornings. And some more symptoms of chronic inflammation include lack of mental concentration, just not feeling well, kind of having a general malaise, headaches, dry skin, dark red tongue, fluid retention, chronic low-grade aches and pains, and gum disease. I mean, inflammation of the gums is actually a very good indicator that you probably have inflammation in the cardiovascular system, because gum inflammation, gingivitis, isn't just a problem of your teeth. It's basically a whole body problem of chronic low-grade inflammation.
Well, you can look at plaque the same way as well, because the more plaque buildup you have on your teeth, the more likely you are to have plaque buildup from inflammation of repair and tissue damage going on in the body as well.
Wow. So it's a good indication you need to work on some of these things. Now, let's go back to some of these blood markers for chronic inflammation and get a little more specific.
I'm just thinking about this list, that I could like hand this list of questions to my clients and have them just check all of these off. I mean, most of us have more than 3 of these. You know?
Yeah.
And like
Well,
you
Barry Sears in his book says if you have more than 3, then you've probably got chronic inflammation.
Right, and it's like you can think of so many people that have so many of these. It would be a good place to start, I think, in a consult, to ask people these questions, you know, if they're having any of these symptoms, because that would give you a good idea of the underlying inflammation going on.
Actually, I think also one of the points of this video is if you don't know where to begin with treating chronic inflammation. Yes. Anyway, go ahead. Let's go back to those blood markers.
Okay. We're going to look at, well, we've already looked at some for chronic, because we did talk a little bit about chronic and acute inflammation before. So we're going to go back to those monocytes, eosinophils, and the basophils, which when those are equal to the 8% or higher, then we know that we've got a chronic situation going on. Then we also have the elevated C-reactive protein. Now, this is becoming more and more of a standard test, but before it was pretty much everything with the cardiovascular system was based on cholesterol numbers, which is not accurate for cardiovascular risk assessment, which has been proven with many studies. So the C-reactive protein is a more accurate number to look for this chronic underlying inflammation, even some infectious things, and cardiovascular risk. So anytime this is going over 3, you know that you have more of a cardiovascular risk. And I see a lot of people coming in at higher than 3. So this is a real good test. It is an extra test to run. Also, the decreased AG ratio, we talked about that under the chronic and the acute inflammation before. So we're saying that if it's equal to or less than the 1.5, even though that's still within the lab range, that we are looking at more chronic conditions going on. 2 other markers that we want to look at are liver enzymes. So we have ALT and AST. Anytime you get that congestion stagnation going on, that there's inflammation that's been there for a long time, that the body has just kind of lost its battle with, then the liver is going to respond. And it responds with the congestion by not being able to move the things fast enough. So usually the liver enzymes will go up.
Okay. And then you've got some more blood markers here too.
We do. So this is back to the plaque issue a little bit here on this one. We have the free calcium index. And that is basically you have your total calcium number that's given on your blood test, and that's called your serum calcium. But you have a predicted calcium, and the way you figure this out is you take your phosphorus times 2.5 equals the predicted calcium. Then you take your actual calcium number on your blood test and subtract that predicted calcium. And if that goes over 1.0, then you know you've got too much unbound calcium going on in the body. And we talked about that. It sometimes shows up as plaque on the teeth as a good indicator, and then you know that you probably got some plaque buildup going on in the body. And that's kind of like the inflammatory response. It's a byproduct of it, that it's coming and trying to patch things, you know, kind of like you would have like a hole in the street and they come put the tar in it, you know, and try to fill it up. That's kind of what the plaque's doing in the body.
You drive a hole in the wall and you put the plaster over it.
You put the plaster over it. So that's kind of what the body's trying to do here. But if there's too much, you know, if you have too much powder and not enough water in a concrete mix, you know, you don't get a solid sediment in there filling in. So you can have too much unbound calcium going on in the body that can cause more bad than good. Mm-hmm. Also, when the total protein is out of balance, it could be high or low out of balance. A lot of times when total protein goes low, though, you've got a good indicator of tissue breakdown. So we're looking at that as well with the inflammation. And elevated total cholesterol, again, we're looking at, I would say, over 300 here.
Okay.
With the total cholesterol. And then decreased cortisol levels, we talked about that a little bit in some previous slides of how it kind of comes in and dampens everything and
so if cortisol is decreased, then it's going to increase inflammation.
Right, and usually when cortisol goes down like that, the cholesterol goes up as well. And then decreased alkaline phosphatase. This is actually an enzyme, but it's a mineral monitor in the body of how we're exchanging if we are dumping a lot of our minerals in our urine. So the minerals can be cooling the electrolytes, keeping things running, and there's not enough there to put the fires out.
Okay. Well, tell us a little about some of the general remedies that we can use for, you know, chronic inflammation.
Okay, well, let's look, again, we're back to a lot of our antioxidants here in the Tygo with the xanthones. That's going to work for chronic inflammation as well as acute inflammation. So we have a general remedy there that you could use for either situation. The noni juice is going to help, also because of some of its antioxidant properties too. The essential fatty acids, we're going to go into more of a response with those that we're going to talk about how they work. But your basically inflammation cannot go into the right response without the right essential fatty acids. So all of the trans fats and the hydrogenated fats that we have in our food is going to aggravate inflammation. So we need to get the good
like all
fats.
The greasy fried fast food stuff.
Well, and the potato chips, and I mean, even if you look at some of your health food stuff, it will have a hydrogenated oil in it, or it'll have, and even in a lot of bakery products now, you know, the trans fatty acids, like in your breads and carbohydrates. So
Right.
we need to really pay attention to hydrogenated fats, trans fats, and looking at what's going on,
And
what the
avoid
content.
them because those are very pro-inflammatory.
They're very pro-inflammatory. So with a lot of the baked products, you know, all of those carbohydrates, then you're going to have an inflammatory response with them.
Right.
Also, we're going to look at the SOD with the gliadin in it. It's going to be another anti-inflammatory.
The SOD is superoxide dismutase, which
Right.
dismantles, is the way I think about it, the
Yeah.
superoxide radical.
So that helps with that free radical attack, and
Right.
it helps to curtail that so that you don't have more tissue breakdown and cellular damage going on in the body. And then also vitamin E, okay? And vitamin E not only helps with the blood for cardiovascular concerns and everything, but it actually works as an anti-inflammatory. Okay, and then lecithin is another anti-inflammatory agent because of help with the emulsification of the fat process. So even though you're putting the good fats in and then breaking down some of the bad fats that come in, or the not wanted fats with those trans fatty acids, the lecithin is going to help displace those so that they don't cause that free radical damage. And then protease between meals. When you're putting the protease between meals, if we think about that healthy cell picture that we saw and how some of those albumin molecules are coming through and some of the debris is coming through because the capillaries or the pores get enlarged there with debris coming through, the protease goes in between meals as an enzyme and breaks that down.
Breaks down the protein debris.
Breaks down the protein debris, which albumin is a protein. So
Great.
it's a type of protein. So it's helping to break down the toxins so that you don't put as much stress on the rest of the body. They don't go around like a little pinball machine dinging things and causing that damaging activity.
Right. Well, actually, there's kind of a process that's a process of the way the body becomes chronically inflamed that, again, a lot of people don't talk about. But basically, most chronic inflammation starts with stuff coming in from the diet. And so what happens is we partake of food allergens and we have toxins in the food and so forth. And so our first line of defense, which is the first area that tends to become inflamed and compromised, is the digestive system. So as these allergens and toxins hit our digestive system, they cause inflammation in the intestinal tract. And of course, with inflammation, think about what that means. The tissue swells, these chemical messengers are released that open up the tissue spaces, and that contributes to something that we call leaky gut syndrome, which is where the intestines leak toxins into the bloodstream and lymphatic system that then are going to go and damage other areas of the body. So this is how our immune system begins to become compromised, is because of repetitive damage to the intestinal mucosa through inflammation, creating leaky gut. So we have some great remedies for that. So why don't you tell a little bit about some of the remedies for intestinal inflammation?
Let's again, the whole aloe vera juice again. Again, we talked about that being a mucilin and how it's cooling. Intestinal Soothe and Build, okay, it's going to have the slippery elm and some other mucilins in it that goes in and cools and reduces inflammation in the intestinal lining. And that is good also, you know, with your Crohn's and your celiacs and your colitis too. Uña de gato combination, which is your cat's claw, and that's a real well-known anti-inflammatory. And that one, if you do that in a little bit larger doses, you're going to get a lot of anti-inflammatory relief from
And
that
it
one.
tends to tone up the leaky gut
It
too.
tends to tone up the porosity of the intestines.
Uh-huh.
And then CLTX, which is very similar to the intestinal soothe and build, but it has the ginger in it. So that's going to give you a little bit more of a delivery system with it. And I don't use CLTX as much as I do the intestinal soothe and build, so you might have some more comments on that one.
It's actually a little better when there's also some spasticity in the colon too. You know what? I forgot to put on here the kudzu St. John's wort, which you
Right, I use
have-
kudzu St. John's wort was what I was going to add on this, because I read a lot of studies, and actually David Winston had some studies one year at the American Herbalist Guild Symposium on kudzu, and it acts very astringent, but specifically astringent on the porosity of the capillaries and of the pores in the intestine. So it really alleviates leaky gut syndrome. And that formula was originally put together as to curtail alcoholism, but when you look, most alcoholics have leaky gut because of the sugars going in and everything that eventually leads to that chronic inflammation, increasing the pores, you know, and then we've got that spillage and the edema coming in. So I use the kudzu St. John's wort.
Yes.
And then the fiber products are a must, because you need to go in and rebuild. And plus the fiber, you have something to bind the toxins with.
So it stops the intestines from getting irritated.
It stops the intestines from getting irritated, but it also stops from the uptake of like auto-intoxication too, of going back through the large intestine and getting back into the blood, of just you continually are recycling stuff. So you get tissue breakdown because you're not getting the nutrients in, but you're recycling the toxins.
Right. Well, if the toxins get through the intestinal membranes, then basically they're going to get into the bloodstream, and all the blood coming off the intestines is filtered by the liver. So it goes up to the liver, thus making the liver the second line of immune defense, because now the liver has to try to process these toxins and prevent them from getting into the general circulation. And the liver does detoxification by means of very complex enzyme systems. And these enzyme systems break down toxins and make them water soluble, so they can be either secreted by the bile or in the urine. And so this next slide shows that you have these metabolic byproducts, microbial endotoxins, different drugs and chemicals, lipid-soluble toxins stored in fat that are released during weight loss. And they go into what's called phase 1 detoxification, where the body electrically charges these by adding or subtracting an electron using these enzymes, so that there's an electrical charge on that, and that creates what are called intermediate metabolites. The problem is in creating these intermediate metabolites, you have superoxide radicals that are created, and these intermediate metabolites are often radical oxygen species, and if there aren't enough antioxidants, they will cause inflammation. So the liver will become inflamed because of a lack of antioxidants as it's trying to go through this process, as will other tissues in the body. And then once it's been processed into an intermediate metabolite, it is carried forward into phase 2 detoxification, where it adds an organic molecule to this electrically charged toxin, so that it can then be eliminated through the kidneys or through the bile and be carried out of the body. So this requires nutrients, and obviously, again, you need antioxidants here to protect your body through this process of detoxification. So we've listed some of the antioxidants here. The Tigo, which is the mangosteen with the xanthones we've talked about. The super antioxidant, which is vitamins and minerals. The SOD, the noni, and of course milk thistle combination, because milk thistle aids with this process.
And we should add the green tea extract here,
Okay.
as well as a good antioxidant, because when you have those ALT and AST liver enzymes going up indicating this inflammation, the green tea extract can help with that.
Okay, and why don't you tell us some of the things that can aid in detoxifying the liver, which also is going to prevent inflammation by getting these toxins out of the body and so they're not affecting the rest of the organs.
Well, we kind of have to look at the liver a little bit to understand some of these reasons we've chosen these detox agents, because you have 11 pathways of elimination from the liver, and just one agent's not going to hit like all of those, so we kind of have different ones listed for different pathways here. One specifically that I use together is the MSM and SAMe, and I would put these two together. And and that helps with a lot of that carbohydrate, the glycogen stores coming over from the pancreas, the high sugar diets, things like that can cause congestion in the liver and inflammation, again, even with alcoholism. So putting the MSM and SAMe together, both of those being the sulfur compounds, are going to release that pathway. Folic acid also creates a methylfolation chain there that we're looking at that helps to send the SAMe into a cycle that it does detox. So folic acid actually even by itself can help detox the liver. Tau Heat Cleanse is a whole package of herbs, and it's already prepackaged with, I think, 5 to 6 capsules in each package, and you just take it according to that. It has the liver balance in it, which liver balance can be used by itself. It's very effective for the liver cleansing. And then one of my favorites that's a little more gentle but helps with the liver cleansing, especially I use it with elderly and children a lot too, is the red clover. So that's a nice detoxification agent for the liver that works mildly, but you still get good results with it.
Yeah. Now, the third line of defense is that once these toxins get in the blood and they're causing inflammation to various tissues and organs, the glands kick in gear and seek to up certain metabolic processes in order to flush these toxins out through other lines of distress. And one of the most important glands in dealing with inflammation is the adrenal glands, because cortisol is involved in this process. So this little slide shows the cortisol pathways, and what it shows is that when the brain perceives stress, the hypothalamus produces the corticotropic releasing hormone, CRH, which causes the pituitary to release the adrenocorticotropic hormone. Boy, those are mouthfuls to say. Which then causes the adrenals to produce cortisol. And remember that cortisol is an anti-inflammatory hormone. It dampens inflammation in the body. And so it's released under stress to dampen inflammation. What happens is a lot of people wind up exhausting their adrenal glands, which makes it so that their body has a hard time controlling inflammation. Let's look a little bit at just some of the things about cortisol. Cortisol is, again, produced by the adrenals. It's an inflammatory mediator. And the corticosteroid drugs like prednisone, what are some of the other ones? I can't remember, are mimics of cortisol. Then there's synthetic drugs that mimic this hormone. And adrenal exhaustion may be the cause of what Chinese medicine calls yin-deficient heat, which is a form of low-grade inflammation that where the person is tired all the time, and yet they're showing symptoms of heat. So it's not true overactivity. It's not like the acute inflammation, which is irritation. This is like a chronic low-grade inflammation, and it's probably due to the fact the adrenals are wiped out, and so there's not enough cortisol to spray and put out the fire and dampen the thing, and so healing can't take place. Now, excessive cortisol production is not good. This is what happens under stress, because excessive cortisol production increases fat deposition and insulin resistance, dampens your immune system, kills brain cells, and causes rapid aging. But of course, one of the problems is that when you have chronic low-grade inflammation, you're also getting chronic excessive cortisol production. So this is a cycle that feeds into aging and so forth. There are some herbs that have a nice cortisol-like action. Do you want to talk about some of those? Or?
Sure. We'll talk about the adrenal support first. Is the adrenal glandular, which actually supports more the adrenal medulla and the cortex together. So with the glandular part of it, and that's going to help mimic a cortisol-like response in the body, so the body's not constantly working overtime to produce it. Licorice. And the next three, the licorice, the wild yam, and the yucca, are all your natural corticosteroids. Yes. So you can use those like you would, basically, a steroid.
Yucca's your favorite, isn't it?
Yucca is my favorite because it reduces inflammatory skin conditions, like really quickly, arthritic type inflammatory conditions that are more acute. Even chronic conditions, you just have to up the quantity of it.
Yeah. Licorice is also good for a lot of different things, but not everybody tolerates it as well. Well, the final thing that we really need to get into is this issue of the eicosanoids and chronic inflammation. And this is related to fatty acids. So it's really important to understand that all your eicosanoids are basically very long chain fatty acids. They're composed of, I think it's 22 carbon molecules with holding on to hydrogen atoms. And so they're synthesized from your omega-6 and your omega-3 essential fatty acids. And this next little slide shows that this is the omega-6 essential fatty acids. Linoleic acid is converted in the body to gamma-linoleic acid, or GLA, which then is converted to this thing that I don't even want to try to pronounce right now. And then that particular intermediate can go one of two ways. It can either be going to the production of arachidonic acid, I think that's how it's pronounced, which produces type 2 prostaglandins that are pro-inflammatory, or it can produce type 1 prostaglandins that are anti-inflammatory. And what determines this pathway is a number of factors. And the first thing I want to do is show you this little chart. This is a little more complex chart with fatty acid pathways. This shows the omega-3 pathway and the omega-6 pathway. And you notice there's these different leukotrienes and all these different little chemical messengers to the eicosanoids that are all produced by these different pathways. What happens is that the same enzyme that converts your omega-3s also converts your omega-6 to arachidonic acid. So if you don't have enough omega-3s, then you wind up getting a higher conversion of omega-6s into the pro-inflammatory prostaglandins. And almost everybody in our society is deficient in omega-3s because we're getting lots of omega-6 and very little omega-3s. Barry Sears, when he first started doing this, started giving people omega-3s, and he found that actually a blend of omega-6s and omega-3s, and he found it worked in a lot of cases, but in a lot of cases it seemed to backfire. And that's when he found out that there's another really important factor going on here, and this is shown on the next slide. First of all, there's things that inhibit the breakdown of linoleic acid to GLA, but high levels of insulin and problems with low levels of glucagon, which is another hormone from the pancreas, will encourage the production of anarachidonic acid. So here we have all of this high carbohydrate diet that people are eating, sugar, refined flour, etc., which is raising their insulin levels, and that is also creating more inflammation in the body. So we have a huge problem with this tending to produce these pro-inflammatory eicosanoids, and so people get this chronic low-grade inflammation going on in their body, and they can't produce the other eicosanoids that are going to promote healing and start getting the body to finish this process and heal the tissues.
Because most of those products contain those trans fatty acids as well.
Well, that's the other thing, is that the trans fatty acids are all preventing the production
of arachidonic acid response.
Yes. Now, there are certain substances that inhibit the production of prostaglandins. The omega-3 essential fatty acids inhibit the pro-inflammatory prostaglandins and encourage the anti-inflammatory prostaglandins. So that's a really good thing to do. Also, using a zone diet technique, which is eating low glycemic carbohydrates. These are carbohydrates that don't trigger a lot of insulin production, will also help to reduce the inflammation. And we have some charts that you helped us develop that basically, they're nutritional charts that show the blood type diet plus the low and high glycemic carbohydrates, and you use those a lot with your clients, don't you?
I do. And everything, if you happen to have those charts, everything's color coded. Your reds are your proteins, your oranges are your protein carbohydrate mix, your blues are your fats and protein mixes, your greens are your low glycemic index carbohydrates, and then the brown category is your high glycemic carbohydrates. And even though some of those say neutral or even possibly beneficial for some blood types, when I'm working with inflammatory responses in the body, especially with chronic inflammation, I have them avoid all the browns. Okay, even though it says some of them are neutral or beneficial for the blood type, I just have them totally avoid it.
Right.
because then you're going to reduce that pro-inflammatory response with those prostaglandins.
Well, there's really two things those charts are going to do with helping people reduce inflammation. One is by identifying avoids for their blood type. They're not ingesting allergens, which are pro-inflammatory.
Right.
And number two, by eating a good blend of essential fats, proteins, and low glycemic carbs, they're also going to be reducing inflammation.
Right. And it gives you the good fats on there too that are in the blues and the purple category. And basically the way I have people follow that is if you just thought about taking your plate and divided it in 4, then 25% of your plate would be one item from the red category. And we're just looking at volume, just content. You don't have to weigh it or anything. And then the other 3, or the 75% of your plate, is from the green category, which is your low glycemic. It doesn't mean 3 different green foods, it's 3 portions. So you have 1 red, 3 greens. Then you can use 1 blue or purple, which are your good fats.
Right.
Okay. 1 orange is kind of optional. It's a lot of your legumes in that
Which
category.
are a protein carbohydrate
mix. And then avoid the browns. So if you follow that at every meal, you've got a low glycemic index.
You're basically
plan.
doing a zone diet plan.
You're doing a zone diet. It's just easy to tell people by color that they're not so overwhelmed that you can go home and you can't do this, you can't do this, you can't do this, because people give up. And I mean, I would too. So you make it easy, and it's, 1 red, 3 greens, 1 blue or purple, 1 orange is optional, and avoid the brown category, and there's your zone.
Right. Now we also have some supplements that inhibit eicosanoid production, prostaglandin production, which can help to reduce inflammation, such as Triple Relief, APS2, and Nerve 8. Now the reason why these help to do this is primarily because they contain salicylates. And salicylates are basically the plant precursors to modern aspirin. And they're found in herbs like willow bark, black cohosh, meadowsweet, and wintergreen, which is one of the ingredients in the Taifu oil. And what the salicylates do is they're just like cortisol. They just throw a blanket over all eicosanoid production and just basically put out the fire. Except that there's also some evidence that some of these natural compounds not only put out the eicosanoids, but also contain compounds that actually encourage the tissue healing and repairing ones, which is kind of interesting. So they also stimulate the production of lipoxins and resolvins, which reduce the inflammation and promote healing. These are, remember, anti-inflammatory ones that promote tissue healing. So if you look at some of those formulas, the APS2 and the Nerve 8 in particular, those 2 formulas can go a little beyond just dampening inflammation to actually promoting the resolution of inflammation and the healing.
I use the Nerve 8 a lot with this, and if you'll just increase the quantities a little bit, it is contraindicated with blood thinners. Need to mention that if you're doing something like Coumadin. So you would have to avoid it with those.
I can't help though, just as a little side comment here, think that a lot of our tissue healing remedies, there's a class of herbs called vulnaries, which stimulate tissue healing, that even though, again, we don't have the research, just practical experience would suggest that probably a lot of these herbs are working on these eicosanoids that are finishing up this process and creating the healing. I mean, a lot of what we don't have scientific evidence for, but we've got plenty of historical evidence that it works. Why don't you talk a little bit about some of the specific anti-inflammatories for both joint inflammation and cardiovascular inflammation, Kim?
Well, for acute and chronic joint inflammation, we're looking at some of these. The joint support, again, I have really good results with that. The joint health, which I think is the Ayurvedic formula that has Ayurvedic herbs in it. MSM glucosamine cream topically to place it right on the inflamed area. And if you notice, like a lot of trauma things, they do use a sulfur type compound to take down inflammation, and that's what the MSM glucosamine cream works like. Then again, we talked about yucca before being a natural corticosteroid, so that's going to help with joint inflammation. And then following that, low glycemic index plan, the food plan.
Okay.
Then on cardiovascular inflammation, we have hawthorn, which I think does have a lot of scientific studies behind that one. You can pull up a lot on the hawthorn. Also, you can pull up a lot on CoQ10. And it every study has shown where all of your statin drugs will deplete CoQ10. So anytime that you're artificially lowering cholesterol, you need to replenish the CoQ10, or the statins are going to cause more chronic underlying inflammation. Megacal, which is the oral chelation therapy, and just when doing your Megacal program, you do need to add minerals back in, because it doesn't really just go in and distinguish between good and bad. It just takes all the abnormalities, the minerals out of solution. So make sure you're putting minerals back in when you're taking that one. And the one that I like to do that works with cardiovascular inflammation when I'm doing Megacal is to put alfalfa in for the mineral, because it does act as a little bit of a blood thinner as well, and you get the minerals from it, and you're working to assist kind of your chelation program with the Megacal.
Yeah.
Also the omega-3s, which we've gone into that whole arachidonic acid response system there on the charts before. Then we're going to go into vitamin E, which can act as a blood thinner somewhat, and I know there are some things that show that vitamin E is an avoid for some O blood types, but yet that's in most normal situations. So when we're in a chronic inflammatory response with this, there are some markers that you can look at to just tell your vitamin E deficiency. So if you look at your elevated MCV, which stands for mean corpuscle volume, or you have an elevated total bilirubin, or the AG ratio that we talked about in the beginning with some of the inflammatory markers is decreased below that 1.5, then those are usually some good indications, especially if all three of those are present, to know that you need more vitamin E in your program, even if you are an O blood type. One thing with the vitamin E, of course, is getting the natural vitamin E and not the acetate. The soy-based with the D-alpha tocopherol is going to be your natural vitamin E. And actually putting the selenium with it is going to help here. The next one, again, we're back to doing the low glycemic or the zone diet. This is where those inflammatory markers come in again with the high grains and the sugars and some of the higher glycemic index foods that would cause an inflammatory response. So paying attention to the food choices here is going to be a big thing in reducing a lot of the chronic inflammation
That's underlying the heart disease.
Right.
Yeah. Well, in summary, what we've talked about is we've indicated that inflammation is a natural response of the body, that it's actually part of the way the body protects itself and helps with the healing of tissue injuries and fighting infection and so forth. And there's a healthy acute inflammation, which you can support the body through that process. But there's also this chronic low-grade inflammation that sets in when the body isn't able to resolve an inflammatory process. And that leads to further deterioration of tissues, and if that chronic inflammation is there long enough, it leads to tissue breakdown, which is involved in chronic, serious chronic and degenerative diseases. So if you don't know where to begin in working with yourself or with other people, one of the best places to begin is by using some just general anti-inflammatory, antioxidant remedies in order to reduce the chronic inflammation in the body and reduce your tendency to develop inflammation, along with altering your diet a little bit so that you're not getting such high levels of insulin and getting some of those omega-3 essential fatty acids, so that your body's going to make the eicosanoids that reduce inflammation and promote tissue healing and repair. Thank you for watching this program. Hope this helps all of you to have better health and also help anybody that you may be trying to work with in terms of clients or family or friends to improve your health and to have a healthier, longer life with less chronic health problems.